We are Christina,
Oneida,
Alicia,
Colleen.
Welcome to 4NP's podcast.
This is a podcast by 4NPs. 4NPs, advanced practice nurses, students, and anyone interested in the medical arts.
That's the number 4, NPS podcast.
If you have a topic you'd like to see covered, please feel free to email us at 4npspodcast@gmail.com or reach out to us through our social media.
For today's episode, we have the pleasure of interviewing Beverly Lang. Beverly is the Executive Director of the Maryland Nurse Practitioners Association. Beverly has such a rich history of experience as a nurse and a nurse practitioner. She is an amazing role model. So without further ado, here's Beverly.
Thank you for having me.
So we like to usually start with your journey to becoming a nurse practitioner, and any obstacles that you have come across, how you've gotten over those obstacles, or what has your journey been like?
Well, I must admit that my journey was a lot longer than some others that are fast-tracking through to their advanced practice degrees. I graduated in 1983 from a community college with an associate's in arts, and then I transferred to University of Maryland School of Nursing and got my bachelor's of science in 1985. And after working for several years in critical care as a floor nurse, and I did cardiac step down, and in the interventional cardiology section at one of the local hospitals here in Maryland, I decided that I was searching for more, and I enrolled at Johns Hopkins for a Master's of Science in Nursing, and I got a dual master's. It was acute care nursing and management, and that was like one of those 70 credit master's programs, which when I look back, it's like, geez, I could have had a doctorate, you know. But that's okay. But I went there and worked then for several years and found myself in academia, liking education a lot. And while I was teaching, I decided one year that I would take a sabbatical, and I went back to Johns Hopkins and got a postmaster's certificate as an adult nurse practitioner at Johns Hopkins. And since that time, I've been working as a nurse practitioner, but until very recently, I was in academia. So I would do my clinical hours on my off time. You know, if I had 4 hours off, I would work those 4 hours as a nurse practitioner. But I certainly did enjoy my role in academia. I eventually retired from academia and then pursued the career path that I have now. And I worked more fully as a nurse practitioner.
Nice. That's great.
But I think that those who graduate and go to nursing school and find themselves wanting more, they are at such an advantage today because they can really accomplish a lot more in a lot less years than I did. I think I went a very untraditional kind of route, but it was the only route back then.
Right.
So
I think the four of us come from a similar perspective of it took us all a little bit longer to get there as well. We all kind of lived life a little bit. We worked a little bit, and the path wasn't a straight path for us. But you're right. There are people, I think if they get started young enough and they have the availability to do that's kind of a straight run, it may work out, a little bit better for them, or maybe a little bit easier to get there faster. Not easier. It's never easier, but it's faster. Yes.
Right. But yes, it's less time consuming. And so they're in the workforce a lot earlier, which in many respects is an advantage, but it also could be a disadvantage because you don't come in with all those life experiences.
Right. And do you feel that before you become a nurse practitioner, do you feel that there should be some time on the floors? Because there are some nurse practitioners that go straight to, they don't practice, they're not in the hospital or an office, medical office, and they go straight.
Now, That is the big debate of the day now, isn't it?
Yes.
There's a lot in the literature about, pros and cons of several years experience before you enter an NP program of study. I felt like I did that purposefully and intentionally.
Right.
I do believe that it helps. It does not hinder. It helps the individual solidify their path in education. Had I not had the experiences I had in the hospital setting, I would never have chosen. I chose to be a primary care adult nurse practitioner, knowing that I really did not want to work in a hospital setting as an advanced practice nurse.
Right.
Now, I think that many of our students who go into it are floundering as they get out of school, because let's face it, most programs of study are graduating more family nurse practitioners than any other specialty. Mm-hmm. So how do you choose, where you're going to go, who you're going to serve? I knew I didn't want pediatrics. That's why I went the adult NP route. Mm-hmm. Yeah, I could have stayed another semester and gotten a family NP. And I just said, no, I don't think I'll ever use it.
Right.
So it was very intentional. But I do precept students who are in the DNP program here in some of the brick and mortar schools here in Maryland. And I have these conversations with them. How did you choose your path? And many of them are still kind of perplexed.
Right.
They have questions.
Right.
They don't know.
Yeah.
They don't know what population they want to specialize in. And I'm like, oh, okay. But, I feel like being a mentor too is so essential. And I would encourage every student, every person who's really thinking about advanced education, to grab onto somebody and have these conversations so that you're more well prepared to go through school.
Absolutely.
But I would definitely encourage a couple years as a nurse to be socialized into the role of the nurse prior to going on to be an advanced practice nurse, whatever path you take in advanced practice.
Right. And I think that's also getting those years under your belt, like whether you're in the surgical area, like I was in the surgical area, whether you do work in peds, whether you're on oncology, it does help kind of guide where you might want to specialize, once you do go on to advanced practice. And I think especially for nurses, like we come out of school or after the master's program, we have 500 to 600 hours of clinical experience in advanced practice. And then we're just basically meant to go ahead and be independent. Whereas like for the physician assistants, they have several hundred more hours than we do. So if we come out of school and we're just thinking about going straight to the master's and going on to advanced practice without actually having practiced as a registered nurse and being on the floor and having that bedside care and really getting that interaction, we're kind of really missing out on some really good lessons and good training and just things that you come intuitively now that we would have never gotten if we just went straight into advanced practice. So I would definitely say for anyone wanting to get their master's that they should, after your bachelor's or your associate's, whatever you're doing, practice for a couple of years. Yeah. See where you fit.
Right. At least 1 year, right?
I agree.
So that you
yeah.
kind of understand how to take care of people, like you said, the whole socialization. Mm-hmm. It's important.
Yeah, I like that you use the word socialization as a nurse because that's a key component that I think sometimes gets missed and people don't think about that aspect of it. But just coming into your own in the sense of feeling that you are a nurse. We talked about that in another episode that we recorded. But the sense that, hey, I'm here, I'm a nurse. You have to become comfortable in that and confident in that. I think when you have that and then you go on for your NP, it makes it a little bit better, a little more. You're starting from a different place.
Right.
I know for myself, if I had gone straight through, I would have been lost. I'm still a little lost.
Me too.
But the truth of the matter is, I'm relatively confident in my nursing skills, my RN skills. I am an RN. I feel like I'm an RN. I have my head wrapped around that. It's just another step up from there in the level, right? As opposed to jumping from not being a nurse to being a nurse practitioner, which is it's a leadership role.
Right. And I think we all have that question that we ask of ourselves. What do I want to be when I grow up? Mm-hmm. And I'm still evolving. I'm still changing.
Awesome.
And to have all these options is just a wonderful thing.
Yeah,
definitely.
Yes.
I think
Yes,
it's a constant,
I agree.
Right.
process that we go through.
Yeah.
Exactly.
So Beverly, why did you initially decide were you a member of the NPA and then you became the executive director? Like, what was that process for you?
Certainly. When I graduated with my degree, well, actually, let me go back to when I was in school. Mm-hmm. I became associated with the National Association, the American Association of Nurse Practitioners.
Okay.
And I looked them up, I think probably in professional issues or one of those courses that you take where they introduce the students to the resources that were out there. And I pondered on that, and I joined AANP as a student and actually was awarded a scholarship from
wonderful.
AANP during my program of study
Nice.
in my postmaster's degree. And I thought, oh, well, this is great. So I got to go as a student to the national convention that they had where they announced my name or whatever. And that got me hooked. But my stint in academia, that is one of the things that I taught my RN students. The need for us to become involved and affiliated with a professional association. And here in Maryland, we have the Maryland Nurses Association, which is the big association for registered nurses. And I always felt myself, you just can't, you got to be a role model. You have to do what you say and say what you do, right?
Right. Mm-hmm. Right. Lead by example.
Yes. Right. Lead by example. So as soon as I graduated from my program, I joined the Nurse Practitioner Association of Maryland, not really knowing what they did. I went to meetings. We have what we call district meetings, where the state is divided up into like 9 districts. And many times you'd go and you'd get a presentation by a pharmacy rep about a particular drug or a particular disease process and treatment. And so I was networking with other people. And I found that to be really very helpful. And I found that I made very good friends, and they were so supportive. That kind of really gave me a good feeling for the professional association. So I did lots of things. I volunteered. I helped at conferences. They pull you in as soon as they see a new face. And I was very, very intrigued. Recertification, I would always get my CEUs from the association here in Maryland. And so I became a part of it. And it was only until much later in like 2012 that I was thinking about where else is my career going to take me? Because prior to that, I was still teaching and working very part-time as an NP. And when this position became available and I saw it come over their website, I thought to myself, well, I could see myself doing that. Why not? I have leadership skills. I think I can do it. And so I did apply and I interviewed and was chosen out of the persons that applied. So I am 100% in with our professional association.
That's wonderful.
Wow, wonderful.
And I know all of you in your own states have your state associations and maybe your local associations. Maybe like Pennsylvania, I know they have like 15
Wow.
because the state is so large. But here in Maryland, I was telling Christina earlier that we are really the only professional association in Maryland that advocates solely for nurse practitioners. And in my role, I see the issues that we're battling. And yes, we were able to get full practice authority in 2015, but it was very intentional. It was very deliberate. We had to have a plan of action. And I'm just amazed that we got it on the first time because so many states are struggling to get full practice authority today. So we were like number 21, I think, and now there are 24 states and the District of Columbia and Guam, I think, that have full practice authority. But this association was integral in getting that for our nurse practitioners in the state.
Right.
And I see that as, if you don't belong to NPAM, why? Why are you not a member? There are over 8,000 nurse practitioners in Maryland, and our association probably has about 10% of that number as members of NPAM. Now, I don't know how that compares to other states, or is it good or statistically significant, but we do garner a lot of goodwill from the legislators. When we go to them, we say who we are and who we represent, and I think numbers speak loud. They really do, and we have a ways to go, but we're always very cognizant of learning about the barriers to practice. And every day, I answer questions of members and non-members alike who come and don't really know if they can order restraints, in a particular setting. And I'm the one that answers all those kind of clinical questions. And if I don't know, I go to a colleague who I know does know, and we get them the correct answer. But I don't know. I got sort of off on a tangent. But
that's okay. We were all listening.
We love what you're saying. So.
Yeah.
But I am of the opinion that every nurse practitioner should belong to their local state organization.
And Beverly, so what are some of the advantages of that for a nurse practitioner?
Well, advocacy is certainly big on our mission statement. And we have a very, very well-organized legislative committee. Here in Maryland, the legislative session is every year. It starts in January. I think it's January 12th this year. And it goes on for 90 days. And during that short period of time, bills are brought to the attention of the legislators. And hopefully, with our help, we look at all of the health-related bills. We scour them to make sure that nurse practitioners are in bills that are looking to prescribe or do this or do that, anything health-related. So advocacy is certainly highest on our priority list. We also offer our members continuing education units. We have a fall conference that's pharmacology based, and we usually do a one-day conference, one and done. And this year we were able to open up and we had it live, but we also live streamed the event. So we had like 100 people live, and then we had another 200 people who were live streaming.
Great.
So that was very cool. And that's the first time we've ever done that. Mm-hmm. And the preliminary results of the evaluations have given us really high grades, which I'm really pleased about. So you can get education, you can network with your fellow nurse practitioners through district meetings. We have a spring membership meeting and mini conference. We try to provide our nurse practitioners who are members, and we have student members as well, with the latest data and the latest information that comes out from Maryland. So we offer them a weekly email blast where everything goes into the pot. If there's something really, a burning issue coming up, we will make sure that everybody knows about it. And the hot topic today is the APRN Compact. You might be familiar with that. Delaware is a member of the APRN Compact. And we just recently wrote a position paper. We do not support the APRN Compact as it is currently written. So those kinds of issues needs to get out to our membership. Mm-hmm. And, they often will say, well, why don't you? Well, I said, read our position paper. And we're very much in tandem with the national associations, not only AANP, but NAMF, which is the National Association for Nurse Practitioner Faculty. They're against it. The American Association for Nurse Anesthetists are against it. The Gerontology Nurse Practitioner Association is against it. The Pediatric Nurse Practitioner Association is against it. So I'm really pressed to find somebody who is in agreement with it. But the National Council of State Boards of Nursing are pushing it. So we're battling them. And so I think our job as an association is to make sure that our members are aware of what's going on, not only locally, but nationally as well. So a lot of our email blasts have information about what's going on in, I don't know, with AANP or whatever. I think that is definitely an advantage. Practice questions certainly are answered. I try to keep very much up to date with all the stakeholders in Maryland. And I try to sit on boards and commissions where they're making decisions about nurse practitioner practice. And I feel like it's very important. Mm-hmm. We have letter writing campaigns. So if legislators are trying to put a bill through that would not be advantageous to nurse practitioners, we get the word out. So, we have fun, Besides all the craziness, we have in our group, and this is just kind of a sideline, one of our pretty new nurse practitioner, she's an entrepreneur. She decided that during COVID, she developed an online t-shirt business. And she has a t-shirt, it's called Herd Immunity. And she had a vaccine t-shirt. And we decided, NPAM decided that we would support her. Okay, so I said, okay. So $5 of every t-shirt that was sold, she gave back to the association, and we put it in the legislative fund.
Wow.
So that we can support things like Lobby Night.
That's great.
Which is coming up in January. And we can use that money to help pay for somebody to go to a fundraiser for a legislator and say, hi, I'm so-and-so, I'm a nurse practitioner, and this bill is coming up, and this is why we do or do not like it, that kind of thing. Mm-hmm. So that's some of what we do. We have fun activities, though, too. The dinner meetings are where our students love to come because they're trying to find mentors. Mm-hmm. and they're trying to find preceptors
Yeah.
for clinical placement. And we do offer members a preceptor list of our members.
Oh, that's great.
Yeah.
It's a
Right.
good sales pitch.
Yes. Yes. So our members are have access to that. They also have access to a mentor list. So here in Maryland, when you're licensed and certified as a nurse practitioner, you have an 18-month mentor period. And you have to send in with your license application the name of a nurse practitioner or a physician who agrees to mentor you. So you can go to NPAM and find out who's on the list to be a mentor and submit that name to the Board of Nursing when you get your license. So that's definitely an advantage.
That's wonderful.
Yeah, we have our own Facebook group, which is members only.
Mm-hmm.
And that's where we get messages from students desperately looking for preceptors and mentors and asking questions, practice questions, or, I don't know. We just had a message put up by a member who said they're having trouble getting reimbursement through Optum, which is the Medicaid provider, payor.
Mm-hmm.
And so that got to me. I'm writing a letter to the Secretary of Health. So this is, I never know what's going to come on Facebook. But most of the time, they're asking questions of themselves, too. Like, I need help with, I don't know, starting my own business. That kind of thing.
Oh, really?
Yeah. We do have special interest groups, and one of which is independent practice owners. One is a psychiatric mental health nurse practitioner group, and they're very active. They have all kinds of activities going on, like a reading group, and they're very interested in diversity, equity, and inclusion. So they have monthly meetings related to that. I think there's more advantages, but, and plus as a student, you get, it's very reasonable to join. And then you get a year as a new grad, which is just a bump up in a fee. And then you go to a full member. We do have a newsletter that we send out twice a year. We often do member spotlights. So you get to know your leadership and your other fellow colleagues that are nurse practitioners. So many times you get people just, and I've heard this, not only myself, but you get emails from people saying, I heard that you're doing thus and such. Can I come and, shadow you for a day or whatever?
Yeah. Oh, that's great. That's so great. What nice opportunities for students and nurse practitioners at every level.
Right.
Even if you've been a nurse practitioner for a long time and you want to switch your role or move a new direction or just meet some people who are doing some different things, it sounds like it's a great place to find that.
Well, we try to serve a lot of different needs,
Yeah.
And as I was saying to Christina, there's so much to do for nurse practitioners. I couldn't see myself doing that for all the APRN people, the different specialties. We're constantly watching legislation because everybody wants to break down this full practice authority, and they can chip it away.
Right.
So we have to be very vigilant.
Yeah. I know you said that Maryland just got full practice authority in 2015. What did that look like from your perspective? So I assume you had to lobby, or your organization had to lobby to get that. Were there other things that needed to be done? I just don't know what that looks like. I was curious to know.
Well, in Maryland, we had a collaborative agreement with our physician colleague. For instance, when I got my first nurse practitioner job, I had to sign a collaborative agreement. And the Board of Nursing kind of constructed that agreement. That agreement was probably 1 inch thick that I had to submit, and answering all these questions. Literally, that collaborative agreement listed every medication that I might prescribe as a nurse practitioner.
That's crazy.
It was crazy.
Wow.
So we went to Annapolis. That was in 2010. We decided that we needed to get rid of the collaborative agreement to retire that. So we took deliberate steps, making alliances along the way so that we could repeal that. And it worked. We are fortunate. We have a couple nurses in Annapolis who are senators, representatives, and we can rely on them to help us out. So the full practice authority meant that the nurse practitioner could practice to their fullest extent. And the compromise, though, for us back in 2015 was this 18-month mentor program. Mm-hmm. So now we're 6 years out from 2015. It was always the intent of the association to go back at some point and have that repealed. If Delaware can have full practice authority without a mentor program and other states do it as well, I feel very confident that we could do that. We can collect data. There's no reports that we know of that as an association, nor have I been informed by the Board of Nursing that the mentor program is making any difference. I do believe that when students graduate, they're ready to practice and they should be competent and confident enough and know that just like you and I would call up somebody and collaborate if I didn't know a particular problem that a patient was presenting with. So I'm wondering at some point, I would love to see us repeal the 18-month mentoring, but that might be a year or two ahead. I'm hoping it's in my lifetime, but so, well, I don't even know how to describe it. I mean, many of the contiguous states around Maryland, we're kind of a small little piece of the pie. We have Delaware, we have Pennsylvania, we have Virginia, we have West Virginia, DC. They're all surrounding us. Mm-hmm. The nurse practitioners come across the border to work here because of the full practice authority. So there's less barriers for them. And I was just reading an article, I think it came across Medscape or something, that salaries are higher in full practice authority states. Interestingly enough.
Yeah.
How about that? And it might very well be that there's more of an opportunity for independent practice.
Right.
We can hang out our shingle.
Right.
Exactly.
And service who we want to serve. So I think that is definitely a bonus point for us. And I get emails every day about people asking questions. What do I need to do to move to Maryland? And, is it hard getting a license? Well, everybody has to deal with their own board of nursing.
Right. You have to go through hoops.
Yes, sometimes you do have to go through hoops. But they're moving here, and I see this as a positive because not every student that you educate in your brick and mortar schools are going to stay in Maryland. Some have ambitions of going out of state to work, etc. But, certainly I wouldn't go to a place that didn't have full practice authority because I'm so used to it.
Right. I think about that sometimes where if I was to move to another state, to have to re-understand the scope of practice for nurse practitioners in that state.
Right. And it would be a deliberate thing, wouldn't it?
Yeah.
Yes. So that's just one of the dilemmas I see that like nurses coming up in states where it's very restrictive. I don't know how they can stay there, but they don't have a point of reference either. So if they were to go to another state for like a interim period and practice, they'd probably find themselves wanting to move.
So, if someone in Maryland, you have a nurse practitioner in Maryland, and they were thinking about joining the NPM, how would they go about it, and what are the time commitments involved?
Well, certainly anybody can visit our website, www.npamonline.org, and there's all kinds of information about membership and joining. And I would certainly encourage everybody, or they can reach out to me individually. I also go to a lot of schools of nursing and talk about membership and the pros of being in a professional membership. I'm invited a lot of times to University of Maryland School of Nursing and Johns Hopkins and Coppin. And, you know, we certainly are out there, but it's amazing to me that not everybody knows about us. Mm-hmm. You know, and I feel like we've saturated the state, but apparently not.
Okay.
Because I still get questions about it. But then again, you know, all the online schools of nursing, they don't really, it's very difficult to capture those students. So whenever I meet a student and say something like, oh, well, I see you go to, I don't know, Drexel, let's say, an online program. Mm-hmm. And how about, you know, talking it up, and I'll send you some brochures, or I'll send you some literature and you can circulate it to your fellow students. And so we try to do it that way. Certainly, as a student, it's $75 to join, and we have rolling join times. You know, if you join in June, then you're re-up your membership in June. And then we have student, we have new graduate, we have full membership, we even have a emeritus and affiliate memberships. And the affiliate doesn't even have to be a nurse practitioner. It could be somebody who wants to just support the efforts of the association.
That's great.
For instance, the Maryland Nurses Association could be an affiliate member, and then they would get all our information. So there really is no time commitment. As a member, you can do as little or as much as you would like to do. I feel like when we get student members, they're very excited. They are just soaking up everything, and they're really very interested in knowing what nurse practitioners do. So they take advantage of a lot of the different activities. And certainly, you know, we do a lot of things that are free, like lobby nights coming up in January, and we're starting to plan that. And we're going to offer CEs. We're going to talk about how a bill becomes a law. And we have a bill that we're going to drop in this session. And, you know, they just like to mingle and be around people. And I think it's so cool to see that enthusiasm that we all had when we were new nurses and then new nurse practitioners. And I still have that enthusiasm many times too. But yes, so really, there's lots of advantages. Many of the things, like the dinner meetings, are free. You just register, show up, have a nice meal, network with people, socialize, have a little bit of fun, and make a connection.
Right.
And many times that's where you hear of, hey, my office has an opening for a nurse practitioner. And it could be a new nurse practitioner. Is anybody graduating soon? Yes. So it's so wonderful to get that connection with one another.
Right.
Yeah.
Right.
I agree. One of our mentors had advised us to do that as well. And Christina, Oneida, and I are currently still in New York. Alicia is in Colorado, but the three of us went and we really had a great time and we connected. We saw some people that we knew way back when we were in RN school. We learned a lot about some new medications coming into the marketplace, and it was just lovely. It was such a nice evening, and we all left there kind of filled with, like you said, hope and enthusiasm and a reminder that why we're here and that we're part of this. And it was great. And we definitely recommend it to our listeners as well.
Right.
And so it's great.
I think those kinds of things really recharge your battery.
Definitely.
Mm-hmm.
And you're like, wow, I am so happy I came. I didn't want to come, or I didn't feel like coming, but I am so happy I got here.
Right. It's nice to be able to network and, speak with people who are experiencing the same things, the same issues, same troubles, and kind of work through it. And it's a good experience.
Yes, absolutely. Absolutely.
Is your next event lobby night, or do you have an event before that that's coming up?
Our next official event is lobby night. That's for the whole association. But every week, 1 or 2 district meetings are being held. So as a member, you can go to any district meeting. You could go wherever you feel like traveling to and learn about, I don't know. I go to several a month. So, it's just so invigorating, and it's just a very good experience. And so those kinds of things are ongoing.
Okay, that's great. I have now a question separate from the MPA and that I wanted to ask you about. I know you have your own sleep practice, and I wanted to hear about your path to having your own business and a little bit about what you do.
Well, I was working at a multi-specialty practice, and I was the after-hours care person. So when people called, they couldn't get in to see their primary care provider, and they were obviously sick or obviously needed refills or obviously wanted to be seen that day. So the calls would come in the morning, and I would work in the late afternoon into the evening up until like 9 p.m. or on Saturdays. So my job there, I saw a variety of people from all these other primary care providers and noticed that, when you would ask questions about, I don't know, what diagnoses do you have? What's your problems? Why are you coming in? Many times I would get a comment like, I have sleep apnea, but you know what? My CPAP's in the closet. I said, okay.
Not going to help you there.
Or they were coming in with some kind, let's say, reflux. And I was looking in their pharynx and larynx, and I would notice, their uvula was very large. Their tonsils and adenoids were large. They had a very large tongue. They had little teeth marks on their tongue where their tongue was so large, etc. And I would say, do you have problems with sleep? And, I was doing all my own homework back then because I wasn't exactly sure where this was going to lead me. And, I snore, or my husband tells me I snore. Actually, he sleeps in the other bedroom now. It's gotten so bad.
Wow.
And I would say, I think you need to be evaluated. Oh, I'm not going there. They're going to give me a CPAP. And I said, maybe. So I did a little self-education, and I spoke with my husband, who's a dentist and an orthodontist, and he said, yes. He said, I get that a lot from my patients. They tell me that they're snoring, or I look in their mouth and I notice they must snore by their structures in their mouth. And I said, well, we need to do something about this.
Mm-hmm. Yeah.
So I decided that I opened my own practice. It's nothing glamorous. It's my name.
That's great.
Beverly Lang,
That's awesome.
CRNP. And I decided I would evaluate patients who needed to be evaluated, who came in with sleep issues. And in order to get a sleep study, you need to have a face-to-face. So I would perform the face-to-face evaluation, and then I send persons off to their sleep study. I only order home sleep studies anymore.
Oh, great.
And they're very good quality. And for mild to moderate sleep apnea, a removable dental appliance is the first treatment modality on your treatment algorithm. However, if you go to a sleep medicine person and you have mild to moderate sleep apnea, you most likely will not be referred to a dentist for a sleep appliance. So this is the quandary. There's lots of literature, research on the topic. Removable appliances are very good in controlling sleep apnea as they increase the airflow and open up the airway. And we've had very good success with those persons, even people with severe sleep apnea who refuse or are non-compliant with their sleep appliance or with their CPAP, can get a oral appliance. Medicare, Medicaid cover them, as do most of your payers.
That's great. Yeah. I was just about to ask about coverage. Yeah, that's good.
Yeah, all your payers will pay a certain amount. Most of them pay the full amount. Certainly Medicare covers the whole cost, and Medicaid. And there are some people who, if they choose, do not have coverage, we can bill them separately, a very modest amount. But, after you have the appliance in and you're working with it and you're sleeping okay, 4 to 8 weeks out, you get a repeat sleep study from the same company I always do, and it's remarkable. You can go from 30 apneic events in an hour to 0.
Wow, that's wonderful.
That's phenomenal.
Yeah.
It is amazing. And I've, like I said, I've done my own research. There's a lot of information out there. I even have a page where I post all these research articles about sleep. And people who come in with bad reflux, the reflux often goes away. Hypertension, blood pressure normalizes, or at least improves. Weight, people lose weight.
Interesting.
With that cortisol.
Because they're sleeping.
Yes.
Yeah.
Right.
Because they're sleeping, that cortisol effect.
Yeah.
Restless leg syndrome. There's a variety of things. Headaches. They're all related to sleep apnea, poor sleeping. And so it blows my mind, the improvement.
Yeah, that's amazing. So we will, if you just give us the information for your clinic, we can put that in our show notes as well.
That's great.
I think it's so wonderful. I love hearing about businesses that are started by nurse practitioners. It's just something that's very...
Yeah. And, it's interesting. It was a good alliance with my husband and I, because he also had been making some appliances, but he wasn't really getting paid for them. He was just doing them because he was trying to help people.
Right.
And I said, but I think these are paid by insurance. And
like everything,
sure
click,
Yeah.
everything kind of comes together.
Yes.
Yeah.
So it kind of all, it was, I don't know, it is just a very cool kind of association. So,
Symbiotic. That's great.
symbiotic.
Yeah.
There you go. That's a good word for it.
My husband owns a comic book store, so I'm still trying to figure out how him and I could work together on something, but I don't know.
I have an idea, actually.
Yeah, right?
I have an idea.
How can a nurse and a guy who owns a comic book shop?
Yes. Well, like we said earlier, what am I going to be when I grow up?
Yeah.
Yeah,
exactly.
Beverly, what do you know now, having all of your experience as a nurse practitioner? What do you wish that you knew when you were a student nurse practitioner or a new nurse practitioner? What do you wish that you knew then, that you know now?
Well, I wish I had done this all a lot earlier in my life. Let me put that out there, because then I'd have more years to be able to practice. What I know now that I didn't know was how much I really love my work with people. And I didn't know that really when I first started. And I didn't know the complexity and the holistic nature of everything. And that has helped me immensely, because there's always something else. There's always something else. And I always ask other questions and of my patients, and it's an amazing feeling to be able to help just a little bit through their life. People do remember you know. I've had patients die and they call me to tell me mom died, and we really want to thank you for being so kind to them. And, we touch their intimate life, I guess. And I didn't realize that even as a nurse. I mean, I didn't realize the depth of intimacy that you get with a NP patient relationship, that you'd feel fulfilled by that. It's not just a job.
Not at all. Right.
That's so great to hear you say that. It's good.
It's very fulfilling, very rewarding.
Mm-hmm. Yeah.
Yes.
Yeah, I love that aspect of it also. I love the one-on-one relationship with somebody and feeling like you're in a position to have a discussion and work as a team with that person to help them to get better. It helps us
make a difference.
Yeah, exactly.
In their lives, yeah.
It's a very special opportunity.
Right.
Do you have any mentors that have helped you?
I do. One of my special mentors was one of my clinical preceptors back in Johns Hopkins, and we still talk today. I have her as one of my best friends, and, I do reach out, and sometimes you're just not feeling it,
Yep.
You're, for one reason or another, you're having a bad day, you're having a bad month, things aren't going as well, and you look to them for advice and advisement and just, I guess, a shoulder to cry on sometimes.
You need them to fill your cup. That's how we say
yes.
it. You need somebody to fill your cup. Yeah, to bring you back.
And, it always comes back to you. It does. It comes back to you. So when you reach out. So I have several people that well, more than a couple, because my kind of world got so much bigger doing the job that I do now. Mm-hmm. And I'd like to reciprocate that too. I really do take my time. And if I'm asked to be a preceptor, I usually say yes. You
might get a couple of calls.
Well, I just feel like we need to give back.
Yes.
And I was very fortunate in my career and in my life. And I want everybody to have a good experience in their career as a student, and then to make them the best nurse practitioner that they can be.
That's awesome.
That's wonderful. That's great. Thank you for listening.
If you like what you're hearing, please subscribe to us and give us 5 stars.
If you have any ideas or comments, please message us at 4npspodcast@gmail.com. Please follow us on Instagram, Facebook, and Twitter at 4npspodcast. That's the number 4NPS podcast. Subscribe to us wherever you get your podcast, and go to our website at 4npspodcast.com for episode transcripts, resources, and more information about us. Be sure to join us for our next episode where we interview Michelle Persico. Michelle is the Director of Clinical Professional Development at Northern Westchester Hospital, which is part of Northwell Health. She is board certified in nursing professional development, critical care nursing, and cardiac surgery nursing. Yup, she's amazing. 4NPs would also like to give a big shout out to Lisa Tran, Terry Murphy, and Debbie Elliott. Thanks for your support.
The information in this podcast is for educational purposes only and should not be used in substitute for professional care by a medical provider. The information in this podcast does not represent medical or other professional advice or services. The thoughts and opinions presented on the 4NP's podcast are of the hosts and guests and do not represent those of their employers.